diabetes, it's something you don't want to ignore, and it's something you don't want to let go. It's something you need to get control of quickly to make sure you don't develop those problems.
Welcome to Living Real Change, a podcast from Piedmont Healthcare. I'm your host, Dr. Lacey Knight, Chief Health Information Officer here at Piedmont. Join us as we highlight the people, the stories, and ideas that are transforming care and strengthening communities across Georgia. From inspiring patient journeys to expert health advice, each episode offers insight, hope, and a closer look at what real change looks like in healthcare today. Diabetes affects millions of people across the country, yet it's often not fully understood until it hits close to home. In today's episode, Dr. Matthew Roberts, a family physician who helps patients manage diabetes every day, joins me to talk about what diabetes really is, the early warning signs to watch for, and the simple lifestyle changes that can make a lasting difference. He also shares how new treatments and support programs are giving patients the tools they need to manage diabetes and take control of their future. We're going to start with the basics. What is diabetes?
So diabetes is, from the doctor point of view, it's your body's inability to process the energy that you eat, which is in the form of glucose. When you eat, glucose goes into your bloodstream. Your body releases insulin from your pancreas, and the pancreas helps pull the glucose into your cells. Okay. With diabetes, you have built up either a resistance to that insulin, or your body is not producing enough of the insulin. From the, let's say, the population health point of view, diabetes is a epidemic. The last numbers that I heard was 1 in 10 Americans have diabetes, and it's even more people that have pre-diabetes. So it is a chronic condition. It is uncurable. We can control it, but it will never just go away. Okay. There are multiple factors that affect diabetes. There are multiple causes of diabetes. It is a condition that we see every day, and it is a condition that affects multiple factors in your life.
So for those that do not have diabetes, what are some of the early maybe signs and symptoms that may prompt someone to talk to their physician about?
You're going to get screened as for your annual physical. When you come in, there's going to be a metabolic panel that we do, and it's going to have a glucose level on it. It should be a fasting glucose, and it'll tell me as your physician what your non-fasting or your fasting glucose is at that time. And based on that number, I'm either going to say that you're a pre-diabetic, you're not a diabetic, or you unfortunately may have progressed to diabetes, and that's going to require some follow-up labs, some follow-up checks. Symptoms now of diabetes. The problem with diabetes is it can kind of sneak up on you a little bit, all right? It doesn't just happen overnight. And unfortunately, for someone who is progressing to diabetes, the symptoms that you run into typically don't happen until later on in the disease. So I would say the majority of the patients that I diagnosed with diabetes don't realize they've got it. Now, they may know that they have risk factors for it. They may know that they're not leading the best lifestyle, but when that diagnosis comes, typically people weren't expecting it.
Let's talk about some of the side effects or the conditions that are related to diabetes. Want to make sure our audience understands why it's important. And then after we maybe talk about the things that having diabetes can impact, we can shift into the things individuals can do to reduce risks of prediabetes as well as diabetes in their daily life.
Absolutely. Diabetes, let's start from the top. It can increase your risk for a stroke, right? It can increase your risk for blindness, okay? Move on down, and it increases your risk for heart disease. That's the big concern for us, is diabetic heart disease. Because once you progress to that, I believe it's a 1 in 4 chance that it's going to be fatal within the next 10 years. There's a condition called diabetic gastroparesis, which is when food hits your stomach, it just stays there. The signal from your stomach to your brain that says, hey, I'm full, gets scrambled, and that can cause stomach upset, nausea. It can cause peripheral neuropathy. Anyone who's a diabetic who is uncontrolled, they're probably familiar with that condition. It's where you get this numbness and tingling in your hands and your toes and your feet. It's not pain. It's it's not, but it's still uncomfortable. Diabetes, it's something you don't want to ignore, and it's something you don't want to let go. It's something you need to get control of quickly to make sure you don't develop those problems.
So, for those of us listening that do not have diabetes, what are the types of things that we should be thinking about or doing to reduce the risk now that we understand how serious this can be?
We know the lifestyles that lead to diabetes. We know some of the social risk factors that lead to diabetes. It's overeating, weight. There is a well-established correlation with weight and diabetes. Lack of exercise, overeating, stress, poor sleep, excessive alcohol consumption. All of those help contribute to diabetes. It's not a guarantee. Not every person who has a problem with their weight is going to develop diabetes. Not every person who has a normal weight or is underweight is not going to develop diabetes. But if you look at your life and you see that you are doing the things that we know lead to diabetes, you need to change them. Don't put it off. Make the necessary lifestyle changes today. 30 minutes, 3 to 5 days a week of a walk. That's all you got to do. Get up and move. Cut your portion size in half and watch your diet more closely.
You mentioned some regular exercise, even something as simple as just walking a few times a week on a regular basis.
Walking is great. Walking is great, Lacey. I would encourage people, if they're bored and they don't have anything to do. There was an article that was written, I think it was in the BBC, quite a long time ago, and the title of it was "The Slow Death of Purposeless Walking." And it discusses how we as a society have changed and our health has gotten worse in general because we don't walk We don't walk as much anymore.
Sure.
Yep.
So start walking. Watch what you eat, get regular sleep, and limit alcohol intake.
It's not complicated. I tell people in my practice all the time, don't complicate it.
Now, I do want to talk a little bit about kind of the research and the treatment options. I'm sure that over the last few decades, things have changed. It seems like there's a lot of optimism related to the types of medications that are available for people that have diabetes to help improve management of the blood sugar, maybe even help support the weight loss that you mentioned as a contributing factor. Can you maybe talk about some of the options that you consider when you first meet somebody that has either diabetes or prediabetes? They know that this is something that they're going to have to deal with for the rest of their lives, but how do you counsel them? What are the types of things you're thinking about now that may be available that were not available in the past?
The big thing that we've seen in the primary care field is the possibility of genetic testing. There's genetic tests that we can do on patients that tell us what this person's risk factor is for the progression to diabetes. And then with early intervention, hopefully we can stave off them progressing to diabetes, get them into an endocrinologist. Endocrinologist can spend some time with them, help make the necessary lifestyle changes, help get them on some medications if necessary. There is, now I focus more on type 2 diabetics, right? I'm a family practice physician. So the majority of my patients are type 2 diabetics, which is, you can consider the adult onset. Type 1 is the childhood onset. 90% of diabetics are type 2, right? Talking about type 1 diabetics, there is now a drug in place that can help slow the progression from stage 2 to stage 3 of a type 1 diabetic. I'm aware of it. That's not something that I'm probably going to be prescribing. If I do encounter a type 1 diabetic that did not know they were diabetic, I get them over to an endocrinologist fairly quickly. Medication-wise, we kind of start with the old standards. Metformin. Metformin's good. It's been around for a long time. It's cheap, and it's effective, and it's safe. One of the good things about metformin is it doesn't cause low blood sugar. Diabetes is dangerous in many different ways. One of the things we have to worry about with a person who's newly diagnosed as a diabetic is low blood sugar. That's where it goes too low. And to be honest, that can be fatal fairly quickly in somebody. So metformin does not cause low blood sugar. That makes it very safe.
What about this newer class of medication that people are talking about? Sometimes just for weight loss, sometimes for diabetes. What can you share about these GLP-1?
Those are great drugs. They've been around since the early 2000s. There is some hesitancy still in people, and they say, okay, well, these are new. I'm not really sure I want to be on them. They're not as new as you say. They just become more popular recently. They're great. They work exceptionally well. There's two classes of them, right? There's the one for weight loss, and there's the one for diabetes. To be on the one for diabetes, prescribed by a physician going through the manufacturer, you're supposed to be a diabetic. The weight loss one, that's a horse of a different color. That's probably a conversation for a different time. The way they work, they're very safe, right? They mimic a hormone that your body produces that tells you that you've just ate. And if you remember, what we talked about is when you eat, your body produces insulin. Insulin pulls the blood glucose out of your bloodstream into your cells, so your blood sugar drops. What these do is they make you think your body just ate, stimulates your body to produce insulin, your blood sugar goes down, lead to better controlled diabetes. Yes, they do cause weight loss. That's a great side effect of them. Okay. Risk factors associated with them, not a lot. They can cause pancreatitis, so we have to be careful in prescribing them for people who have a history of pancreatitis. The more common thing that we see is stomach complaints. If you eat what you're not supposed to eat, it'll get you. That's what I tell people pretty much word for word. But if you are on a healthy diet, you should be fine with them. Coverage is always an issue with these. You asked what some of the first drugs I go for. I would love to be able to put the majority of my patients that come through that have a new diagnosis of diabetes on these medications. They're more expensive. So insurance companies typically make us reach for metformin first to see if that one's going to be effective. But I like it. I really do. They have been, let's just say, life-changing for a majority of patients. Some of the best success stories I have with diabetes are because of these medications.
That's great to hear. Can I ask what type of support resources or supplemental resources can help patients that may have diabetes, maybe the newer diagnoses? We've talked a little bit about kind of the behavioral pieces that can contribute to or help manage or improve diabetes. We've talked a little bit about the medications. Are there support arms that you engage for patients to help them improve the management of their risk factors or their disease?
There is. I kind of consider myself the first part of the support arm. When someone comes in for a new diagnosis, I'm going to spend some time with them, kind of try to figure out what they know. What do you think diabetes is? What do you know about it so far? And then we'll try to get them in for a couple of visits in a very short period of time just to follow up on them, right? I don't want somebody to get a diagnosis of diabetes and I'm going to put them on one medication and then I'll say, okay, come back in 6 months. Yeah, it's not going to happen. I want to see you again in 2 weeks. I want to see you again in 6 weeks. And then I'm going to offer them a referral to our diabetic education program. Piedmont has a great program. It's run by PAs, medical assistants, nurse practitioners. It's a virtual, so online, diabetic education program. You sign up, you do classes. They help you choose the foods. They help you with your glucose monitoring. They make sure you know how to use your devices. And they make sure you're taking your medication the right way. It's a big diagnosis. And I try to make it as unscary as possible because there is a lot of information that is going to be coming at somebody in a fairly short period of time. So we try to spread it out as much as possible and If they do have questions, make sure that we're available there to answer those questions and get them to the people who are going to be able to spend the time with them and sit down and answer those questions. There's also going to be community resources. A nutritionist is great. And if you remember, I said 1 in 10, or even more so, 1 in 8 people have diabetes. If you get diagnosed with diabetes, ask your friends, ask your neighbors. It's as a physician, it's reassuring to me when someone says, "Oh, well, my sister's a diabetic," or "My brother's a diabetic," and they can help me use my glucose monitor. They can show me how to do this. They can show me how to use this pen, my medication injection.
At Piedmont, quality care changes lives. Meet Brad, a healthy former Marine who unexpectedly suffered 5 heart attacks and then heart failure. He credits Piedmont with saving his life.
The teamwork it took to provide me a path forward through a surprise heart failure and almost 5 months of intensive care in 3 different Piedmont hospitals is difficult for me to even imagine, but you guys nailed it. How do you thank someone for the gift of life?
Hear more at piedmont.org/qualitycare. Piedmont, real change lives here.
So we've covered a lot of different topics. Maybe didn't dive enough into prediabetes. Can you maybe spend a little bit of time talking about what that is? And
Prediabetes is, it's not a disease, right? Diabetes is a disease. Prediabetes is not a disease. Prediabetes is I guess you can say it's more of a syndrome, of your body's developing a resistance to insulin. It's a yellow light. It's a warning. We catch that when someone comes in for their lab work and their glucose level is between 2 certain values. I checked their A1C. All right, let's talk some doctor talk real quick. A1C is the lab test that we use to diagnose diabetes. Okay. A value, an A1C number between 5.7 and 6.4 puts a patient in the pre-diabetic range. So that's what I'm going to check. If I have a patient who's a pre-diabetic, I'll bring them back in. We'll talk about what you need to do. All right. These are the lifestyle changes. All right. This is the point in time where you need to get serious about it. You can even go on medication for it. Right. Metformin is a very effective drug at helping prevent the progression to diabetes. Okay. I would love to be able to put patients on the GLP-1s, like we talked about, the injectables, the new ones, because those can help prevent with the progression to diabetes. But it's not a disease. Like I said, it's just a syndrome. It's a time when someone needs to really get serious about their life, making the necessary changes, and figuring out what they need to do to help prevent the progression from diabetes. It's good that we have this definition, because now I know what my high risk patients are, as opposed from someone just going to not diabetic to, hey, you got diabetes, with no sort of time in between to make the necessary changes to help try to prevent that.
thanks for the explanation.
One thing I do want to cover, talk about symptoms of diabetes. We tend to associate diabetes with weight gain. Okay. One of the symptoms that you can look for in a patient who is a new diagnosed diabetic, that has progressed to uncontrolled diabetes, is actually weight loss, right? The human body is exceptionally resilient, and people will be a diabetic for years and years and years without knowing it. If you remember, I said diabetes is the inability of the body to process the energy that you eat. So if you can't process the energy that you eat, you're going to start losing weight. So if someone has lost a significant amount of weight in a short period of time, 50 pounds over the course of 2 months, you need to go to see your doctor, because obviously something's wrong. But diabetes is on the top list of things that could be wrong. You're going to be excessively thirsty, and you're going to be going to the bathroom. You're going to be peeing all the time. The drinking all the time doesn't slake the thirst. You go to the bathroom all the time, and you're losing weight. That's the big red flag. That's the sign that you may have uncontrolled diabetes and need to get to your doctor immediately.
Well, thank you for highlighting that. If you were going to leave kind of our listeners with just some key thoughts or messages around this topic, what would those be?
Don't complicate it. We talked about that before. Eat right, exercise. It sounds trivial. I'm sure people have heard their doctor say it before. The reason we keep harping on that is because it is really that simple. Go outside, walk 30 minutes a day, 3 to 5 days a week. Look at your diet, make some necessary lifestyle changes, do those, and keep a good relationship with your primary care physician. We are the ones who are going to catch this most of the time. We're the ones who are going to help you through it. It's not a death sentence, all right? But you do have to respect diabetes. We have somewhat become complacent as a society, I feel, because this is such a ubiquitous disease. You see it everywhere. I think they said within the next couple of decades, 750 million people worldwide are going to have this. So you're going to see it. You're going to get comfortable with it. Don't. Learn to respect it. Don't let it sneak up on you. Go see your doctor. Keep the appointments. Live a healthy life, right? You can enjoy your life. You can eat good food. You can eat healthy food. And just keep in mind that this is something you need to respect.
Thank you for listening to Living Real Change. To hear more stories from across Piedmont Healthcare, be sure to subscribe and watch for upcoming episodes. For additional health tips, news, and resources, visit us at piedmont.org/living-real-change.